The Royal College of Nurses union voted for their first strike in its history this week. The industrial action comes after a long dispute over pay. Members are requesting a 17% pay rise. Prime Minister Rishi Sunak says this request is simply not affordable. I was really keen to get the view from the front line, and I'm delighted to say that Sarah Guest, who has been a nurse for over 36 years and has not supported strike action until now, got in touch with us and was happy to come on and chat to me about it. It really is great to see you. Thank you very much indeed. What changed your mind this time?
Well, over a number of the last 12 years, nurses' pay has failed to keep up with inflation. And if so, in real terms, year on year, we've had pay cuts. Over a number of years, there's a lot of nurses have left the NHS. In the last year, there's been apparently a 25% increase in the number of staff leaving the NHS. There's shortages of staff on the front line that is actually affecting patient safety. So that nurses can't actually safely care for the patients how they want to care for them. That's sure. Really the crux of it. I joined the RCN years ago because they're not politically affiliated to any of the political parties, and they've always been anti-strike. As it happens, myself, I won't actually be going on strike because not enough. The threshold for the number of people actually voting who are eligible to vote in the district where I work hasn't been met. So there are some areas around the West Midlands area where they are going to be striking, but not in the health authority I work at because there's not enough people actually voted to strike.
I only butt into because it's a confusing thought. You're absolutely 100% right. Of course you are, because it affects you. But as far as the RCM ballot's concerned, it's not just a national ballot, one out, all out. No. It's each sector has its own ballot, and only if that sector reaches a majority do they go out. Here's a problem, Sarah. I would love to hear your thoughts on it. And you mentioned about job security and conditions. That if the government were able, not 17%, but perhaps somewhere in the middle, to come up with some extra money for your pay, then that might make more folk either want to come into the profession or stay in the profession. But the kitty will not have the money then to pay them. They might be able to give you a bit more with the cost of living challenges, but they won't be able to employ that woman or that man over there who now wants to become a nurse. I mean, it's a really tricky problem for the government.
It is. I mean, it's a problem across the whole of the public sector, I think, not just nurses. Other healthcare professionals as well are facing challenges to recruitment and retention. The one thing that has made things more difficult with nursing is, for many years, nurses were employed by the NHS when they did the training, and when training first went over to universities, nurses still received a bursary and didn't pay tuition fees. But nurses are now coming out of their training after 3 years with the same amount of debt as my son, who's done an IT degree and is on a far bigger income than what nurses start on.
There was a really brilliant article by a doctor in the Daily Mail earlier in the week exactly about that training scheme, and that was one of his 3 points to sort it out, to then get young folk coming into the profession. But finally, I want to put something to you, and I don't know whether you know Anne-Marie Rafferty, Dame Anne-Marie Rafferty now, but she's a former president of the RCN, and she told me on GBNews yesterday that two of the key problems in nursing are that young people no longer see it as the draw that it once was, and that many of those who did are leaving due to low pay stress and the simple pressures of overload.
Yeah, I mean, some nurses around my age are leaving because they've changed the pension scheme, and now the pension scheme that came into being in 2015 is linked to state retirement, state pension age, whereas the pension scheme I joined, you could retire at 55, and people are thinking, I don't want to pay into this, I don't want my money to be tied into retiring at 66 or 67, so they're taking their pensions now, so that, you know, as they originally joined up to do, and some nurses are coming back, but with the abatement rules around the NHS pension scheme, you're not allowed to earn any more money than what you did work full time. So if nurses are coming back after they've retired and they're under 60, they're coming back part-time because they're not allowed to come back full-time, even if they wanted to.
It's an unholy mess from top to bottom, I think, Sarah. Thanks for getting in touch with us, and I want you to keep in touch, even though I now understand you're not going on strike. You voted to go on strike, but because there weren't enough of you in that particular... But keep in touch. We'll talk again if this thing does come to a strike, and maybe talk again after the budget on Thursday. But for the time being, Sarah Guest, NHS nurse, thank you very much indeed for your time this Saturday afternoon.
Okay.
Delighted to say that an old friend of mine, Stephen Dorrell, was listening to that, I hope. Stephen's former Conservative Member of Parliament and Health Secretary, ex-chair of the NHS Confederation. He is now a Liberal Democrat. I'm talking to Catherine Forster earlier, our political correspondent, and the word that kept coming to my mind in all of this was grip. It's a shambles, whether it's the amount of money being spent on agency staff, the risk of losing people like Sarah from the profession, the waiting lists. For goodness sakes, have you ever seen anything as bad as this, Stephen?
Well, I think the statistics demonstrate that the problems are worse than they've ever been in the health service. The waiting list figures you quoted, I can also quote to you the problems of getting access to GP surgeries. I can quote to you the problem of waiting times in A&E departments, ambulance waits, and so on. So right across the health service, there are huge problems. And clearly those problems would be made worse if the threat of a nurses' strike did materialise, which is why it's so important that ministers address head-on the issues that are raised by the threat of this strike and seek to avoid it.
Yeah, and that which leaves me confused as well. And I go back almost to my theme of grip, because 48 hours ago I was reading that the RCM were quite pleased because Barclay seemed to be taking a slightly more emollient approach to the pay talks, and both sides welcomed that. That was very good. And then he's reported, a former chief secretary, number 2 in the Treasury, reported in the papers this morning of having told the Treasury that NHS doesn't need any more money.
Well, I think if Steve Barclay, as Secretary of State for Health, thinks the NHS doesn't need any more money, he's the only person in the health service who believes that's true. That's not to say, I mean, I heard your interview with Sarah, and you were, of course, wholly right to say that there are no easy answers in this for ministers, and there are choices to be made. I completely accept that. And I, incidentally, just for the record, don't think a 17% pay increase for nurses is something that can be justified. But ministers need to address the question, and your suggestion that they need to take a grip must be 100% right. There are no easy answers, but there are steps that can be taken to ease the pressures in different parts of the health service. And what Steve Barclay ought to be doing, frankly, 24/7, he should be working long hours, as nurses do, to find solutions that ease pressures in the different parts of the health and care system. Let me make the point I always do in these conversations, that if you think that the NHS is different from social care, you're missing the point.
And we both will have read in the papers, both yesterday and today, but particularly underlined today, is that Sunak apparently has decided to kick the issue of social care into the long grass yet again. Let me put this to you, because I stressed at the beginning that you've been there in the hot seat, you've watched these things unfold. Is there a real danger here, both for Steve Barclay but also for Rishi Sunak, that they have relied too much on the goodwill of nurses. Nurses are lovely men and women who simply won't go on strike. Are they, and we're looking at Jeremy Hunt now, former Health Secretary, former Chancellor, and Rishi Sunak, former Chancellor, now Prime Minister, are they about to be in for the shock of their lives?
Well, I hope not is the answer, but they will be if they take people for granted. You say I've been in the hot seat, I've been there. As it happens, Alistair, you won't remember this, but I do, that the day I was appointed Health Secretary in 1995, there was indeed at that time a threat of a nurses' strike. And it was clearly one of the first things I had to do. And I'm not claiming any great credit for this, but we did, myself as the minister and all the supporting officials and managers through the health service, we did find a way to relieve the pressure that was building at that time. And that's the challenge that Steve Barclay faces. And of course, Steve Barclay needs to take the Chancellor and the Prime Minister with him on that journey.
Yeah. Final point, for a general observation with your purely political hat on, and I discussed it with Alan Jones from the PA, industrial editor there, and Benedict Spence, the commentator, earlier on. And it's this, it's a double barrel, it's a Purdy of a question. One, the trade unions sense blood. This is a government with its back against the wall, rightly or wrongly, and they're going for broke. And secondly, Sunak and Hunt particularly are so dug into defeating inflation that any other issue, even strikes in hospitals, is at the back of the list. Is that what we are looking at the moment, for better or for worse?
Well, your previous question asked me, is there a danger that the government, all the individuals within it, take nurses for granted? And I think there is a danger, and that's why it's so important that they're seen to engage in conversation. I think there's an equivalent danger, if I may say so, in the question you've just asked, that the trade unions overplay their hand. There is no doubt about public support and sympathy for the nurses, and there's no doubt either that other public sector workers have a case to be made around their pay and conditions. But if the trade unions cross the line and play this as a political game against the government, then I think they will lose public sympathy very quickly. This is about ensuring, in the health service context, that we have the nurses, doctors, all the clinicians and other staff that are required to address the challenges that we started off by talking about, which are the ability of the health service to meet the demands placed upon it in waiting times and emergency care and so on. And that's the issue that both the employers and the trade union staff representatives need to keep at the forefront of their minds.
Stephen, thanks for your time this Saturday afternoon. Always a pleasure, genuinely. Look forward to talking to you again very soon. Stephen Dorrell there, former Conservative MP and Health Secretary, and now a Liberal Democrat supporter. You have been getting in touch on our big topic of the day, the strike actions, whether it be in the hospitals or whether it be in the schools. David says, the school I led in Liverpool gave away much more money in free places to disadvantaged pupils than it received in tax relief, which equals public benefit. I think that's the case for the majority of private schools. Barbara says, no to a teacher's strike. I'm a retired teacher and I changed unions so that I didn't have to strike many years ago. Children have suffered enough during the pandemic, as usual. It's the children who'll suffer most. The children who will suffer most will be those of parents who can't afford extra childcare, and they will have to take unpaid time off work. They're also the ones who can't afford extra tuition. And finally, Joan, no one wins with strikes except the unions. It is pathetic that NHS, teachers, railways, etc. are even contemplating it. Keep your views coming in. We've got another 40 minutes or so of the programme, and I'll try and fit some more in at the end. You can do it gbviews@gbnews.uk or on Twitter or on Facebook or direct to me.